presentation is on vision impairments in young children. Okay, so what is considered a vision impairment? So according to IDEA, a vision impairment is a visual disability that still impacts a student's academic performance even with correction. So what it's like living with a vision impairment. This disability is a result of problems with acuity and peripheral vision. Acuity is determined by whether a person can see at certain distances, and peripheral vision is the width of a person's field of vision. So it's like everything right here. And that's a model to show you. And there are two categories for visually impaired people. People with low vision and people with blindness. Blind children cannot utilize their sight at all and must rely on other senses to learn. And children with low vision can use their vision for certain activities at school but still need support. Blind students specifically are put into either the groups of congenitally blind, so they're born with blindness, or become blind during infancy, or adventitiously blind, which is blindness developed after 2. The difference in these groups is significant because children who are adventitiously blind can rely on their memory of objects, whereas congenitally blind people don't have any memory to base their experience on. So examples of visual disability is myopia, so seeing close objects clearly, while faraway objects are blurry. Nearsightedness, that's what I have. Hyperopia is seeing faraway objects clearly, while nearby objects are blurry. That's called farsightedness. And then astigmatism, I also have this. It's an issue with how the eye focuses, and it is a degenerative condition, so it gets worse as you age. Then there's blindness, and of course there's tunnel vision, so that's the loss of your peripheral vision, so you can basically only see like in front of you. Okay, so the causes of childhood blindness are retinopathy of prematurity, ROP. It's an eye condition that occurs in premature babies when blood vessels in the eye are improperly developed. Nystagmus is rapid involuntary movements of the eye. Cataracts, when the lens of the eye becomes opaque, resulting in blurry vision. Glaucoma, loss of vision caused by damage to the optic nerve. Non-accidental injury. Cortical vision impairment, CVI, which is actually the lead cause of childhood blindness. That's problems with vision caused by brain damage, so it's not actually problems with your eyes, but your brain. Optic nerve anomalies, albinism, when the body produces little to no melanin, and hereditary retinal dystrophies, inherited disorders that cause damage to the retina, typically worsening over time, so it's also degenerative. Okay, so the history of childhood blindness, or blindness in general. 1829, the first American school for the blind is established in Massachusetts, named the New England Asylum for the Blind, but it is now known as the Perkins School for the Blind. 1834, Louis Braille creates Braille. 1837, Ohio creates the first state-funded school for the blind. 1860, a school in the U.S., the Missouri School for the Blind, becomes the first American school to use Braille. 1887, the Perkins School for the Blind creates the first kindergarten program for blind children. 1893, the first Center for Blind and Abandoned Babies opens in Connecticut. 1918, the University of California creates the first course on teaching blind students. 1941, a trend of retinal fibroplasia, now known as retinopathy of prematurity, is recognized. And in 1953, Dr. Abraham Nemeth develops a Braille code for math, and that's called the Nemeth Braille Code. so here we have prominent figures. So we have Anne Sullivan, who was the one who taught Helen Keller how to communicate, and then of course Helen Keller. Louis Braille is right up here, and then Valentine Howie. He established the first ever school for the blind, and this video is actually going to be a part of our activity. I'm going to play it twice. The first time, I'm going to ask you to close your eyes, and then the second time, we're going to watch it like normal, okay? So close your eyes now.
In this room sits a remarkable woman. She's Miss Helen Keller.
She felt the vibration of the spoken word. She feels the G, the hard G. On the lips, she feels the B. I am not dumb now.
Okay, so name 5 facts you learned in that video. All right, cool. Now we're going to watch it again.
In this room sits a remarkable woman. She's Miss Helen Keller.
She felt the vibration of the spoken word. She feels the G, the hard G. On the lips, she feels the B. I am not dumb now.
Okay, now can you name some facts you learned in that video? Go ahead.
She was the first blind and deaf person to receive a bachelor's degree.
Anybody else? All right. So I thought it was pretty ironic that a video about Helen Keller primarily relied on only written or typed text.
Yes.
So how did that make you feel, not being able to know what's really going on and me asking you to share information about the video?
Confused. Yeah, and I feel like when the music was playing, when my eyes were closed, I was like,
like I first started envisioning like what they were trying to do, and then I was like, then it went off to like, I don't know, like a warm beach, and I was like, hold on, bring it back. Like I kept getting distracted, and I'm like, hold on, this is about Helen Keller. Like it was hard to focus. I felt like, that's crazy.
So, relevant statistics. An article by Constable states the prevalence of childhood blindness is estimated to be 1.4 million worldwide, with an additional 19 million children categorized as visually impaired. The Individuals with Disabilities Education Act, IDEA, provides services for 26,000 students with visual impairments, making them a minority among all students and a minority among disabled students. The Office of Special Education Programs, OSEP, reported that 69% of visually disabled students spend most of their day in general education classes. So, some symptoms and behaviors of visually impaired children is challenges in interacting with peers, primarily socializing with adults over children their age, preference for structured play over spontaneous play, difficulty understanding physical boundaries. They may be overly affectionate or not understand personal space, asking questions unrelated to the current situation, and problems with sharing. So the diagnosis process and tools associated with it. So first, a child would undergo a basic evaluation with a pediatrician. If problems are noted by the pediatrician, they are referred to a pediatric ophthalmologist. If the extensive exam done by the ophthalmologist doesn't provide answers for the issues with vision, there's a chance the child has a cortical visual impairment. If CVI is a suspected cause, the ophthalmologist will review the child's medical records looking for a cause of CVI. The doctor will ask the child questions about their vision using tools like Teach CVI and Dutton's Visual Skills Inventory, and then the ophthalmologist will observe the child and observe various visual skills. Their visual attention, that's the ability to notice things, recognition, the ability to recognize different objects, different people, movement, and hand-eye coordination. Okay, so there were actually not a lot of therapies and treatments I could find, and I think that's primarily because there really isn't a cure for visual impairments and things like that. So mainly it's just occupational therapy, visual rehabilitation, and glasses that can help children with visual disabilities. All right, so teaching strategies and accommodations. So conscious seat placement, it really depends on, a child's ability to see can depend on the time of day it is, the lighting, how close they are to something. So you have to really be conscious of that when you're teaching a child that's blind or visually impaired. Fostering an accepting classroom, teaching other students that their classmate has this impairment and understanding what it's like to interact with them. Providing clear instructions, help the student get oriented with classroom landmarks and emergency protocols. A lot of schools have specific protocols for visually impaired children. If the child has a guide dog, teach other students that that dog is not a pet, and it is highly trained to help that student. Add visual contrast to worksheets and learning materials, and use a lot of color. Okay, so I have some examples of assistive technology. So there's screen readers, magnifying glasses like this one, here, voice recognition software, braille, digital assistants, and audiobooks. And here are a few controversies and misunderstandings. So myth number one is people who are blind see total darkness. Only a small amount, about 15% of blind individuals see total darkness. Most of them can perceive light, shape, or color. Myth number two is that children with visual disabilities shouldn't engage in physical play to prevent further vision loss. Physical activity is beneficial for all children and can actually help visually impaired children get more acclimated to their environment and develop their perceptual skills. As long as the student isn't advised by a medical professional to avoid physical activity, they should be fine. Another myth is we are born with vision. No one is born with 20/20 vision. It is a ability we have to strengthen, just like we have to strengthen our muscles to hold our neck up or to be able to walk. Myth, children should get their first eye exam at 6. A child's first eye exam should be at age 3, and then if no issues are detected, their next exam should be at 6 years old. Another myth is sitting too close to the TV can injure your eyes. Fact, it is not possible to damage your eyes by sitting too close to the TV. All right, that's it.